Type of exercise and eating behavior on obese subjects. Nutrition of Exercise Science by Haley Hunt. Obesity entails a public health challenge, provided that it links many risk factors associated with comorbidities and cardiovascular diseases, pointing out the need to have further studies on the same. Hajar, 2017. The healthy habit of nutrition and physical activities is related, and it aims to maintain our body mass at its required level. But diet does play an essential function into reducing the weight loss. Exercise is critical in maintaining this loss. Therefore, to support long-term adherence in healthy eating behaviors and habits. Research shows that if the food intake were modulated by exercise, then participation in physical activity and the intensity and duration would support the appetite regulation and average intake of calories and the consumption of macronutrients of diet. The nutrient could result in optimal balance of energy. Other studies have indicated a linkage between motivational and psychosocial and physical activity associated with healthy eating behavior. So although the form of exercise that might bring profound behavior and psychological alterations linked to food intake and eating behavior remains imprecise, prolonged exercise intervention would lower everyone's daily energy intake. Several studies show that the caloric consumption was advanced in increased exercise intensity compared to the moderate exercise intensity concerning the weight of the effort. Many studies included normal weight and aerobic prolonged adherence to diet and exercise and composition of the diet. Thus, the present research tries to evaluate a type of physical activity or exercise threshold that favors quality adherence to prescribed diet, improved eating, linked motivations, and the healthier diet composition in obese and overweight subjects. So looking at the participants, the information for the research was obtained from physical activity and nutrition for the treatment of obesity. The method used to include individuals was specific to adult subjects aged between age 18 and 50 years and obese or overweight, sedentary, non-smoking, or non-glycemic. In the case of females, they experience regular menstrual cycles. And from the 180 participants who complied, more than 90% of training periods and 80% were adherent to diet total. 162 subjects were involved in an analysis concerning the effect of form of exercise, and 91% of participants in the analysis regarding the physical activity influence. So looking at the study and intervention and design, the study intervention lasted for 22 weeks. The assessments occurred a week before and after the intervention. The subject was randomized through the drawing from a lot composing of one of the intervention groups: physical activity based on guideline, endurance training plus combined strength, endurance training, strength training. This randomization assured a homogeneous supply of gender and age among the groups. For the exercise protocols, the PA team assumed basic physical activity recommendations, which were availed to participants through individual meetings. Subjects from different groups were trained several times a week with close supervision by certified personal trainers. The training was designed for the heart's reserve rate and muscle strength and was performed in a circuit. The exercise adherence was measured using the number of completed sessions regarding the theoretical sessions. Hypercaloric diet. The entire participants went via personalized dietary interventions regarding the hypocaloric diet by professional dietitians. The Spanish community recommendations in nutrition were used to set the distribution of the macronutrients. When looking at assessments, routine physical activity was measured with the employment of specific sense, where, and the information inclusion assumed the path introduced elsewhere. 3 daily categories of steps concerning the initial data were established. Different activity levels were measured by taking an average of 3 good days. Daily expenditure of energy was calculated by employing the body media algorithm. The participants' beverages and foods were noted using questionnaire, food frequency, and day drink and food records. Participants were required to record the volume of food taken using the household measurement or note the commercial packaging volume. Energy intake from the diet and different macronutrient percentages, which differed from the food taken, was recorded. The evaluation of cause was done using a questionnaire critically developed for this research. The questionnaire comprised of 5 questions that followed a specific criteria rating. 2 questions were linked to exercise reason, while remaining 3 were related to diet motivation. The diet-related basis was punctuated by the participant based on the set questions: what defines your motivation? To bring change to diet, to move forward the control of dietary appointment, to lower the composition of fat, sugars, and alcohol. On the other hand, the subjects attained the exercise-linked motivation through answering question: what defines your motivation? Performing a routine exercise, conduct the physical exercises activities required in the program. An average score for the practice and diet-linked basis was obtained by adding the performance of specific questions, and acceptable inconsistency was attained. The assessment of body composition height was done, and body mass was measured. Looking at the statistical procedures, data was presented as the mean, and analysis were done to differentiate the baseline among the intervention groups under study. 4 ways of repeated measures were employed to determine the variation among the intervention terms and the gender timely. Critical variations were denoted using specific tests for differences. Lastly, the groups were separated using clear correlations, which tested the association between motivations, physical activity, behavior changes, and the entire analysis was done and significance level was set. So, looking at the results, from the studies, the differences among the intervention groups were not observed for any variables. A vast negative correlation was observed in the entire intervention group, moderated to extensive correlations between nutrition and motivation, and exercise was more so marked in whole groups. Analysis indicates that the intervention team reduced the body fat and weight percentage and raised the lean mass. Males possess higher body weight mass and reduced percentage of body fat than females after and before interventions. Additionally, the gender group association and body mass index group time interactions were evident. Males utilized more calories than females in post and pre-interventions. Obese subjects indicated greater total energy intake compared to the overweight participants in before and after interventions. However, no association was seen between the intervention group and time, and everyone's lowered energy intake. The remaining factors and interactions were relevant. Nutrition-related motivation, like the diet, indicated a rising tendency before and after intervention without a pertinent association between gender body mass index. In conjunction to exercise motivation, the association between time and gender was observed, and only females raised their level of motivation upon the interventions. The association between time and intervention groups was also observed, and the pairwise comparison indicated that only the physical activity team reduced motivation to the exercise. When the analysis of the sample was done, the same outcomes were evident. Changes in the body composition were in similar directions as evident in the intervention teams without having variations in daily categories of steps, body fat percentage, and body weight percentage had reduced, and the mass of the lean body was increased. The evident tendency to increase the nutrition-associated motivation in the entire intervention teams was relevant without the associations with everyday step categories. Time-gender association was obtained to motivate the exercise where only females raised their motivation after the intervention. So going into the discussion, the total caloric and macronutrient distribution. The primary findings from the research had many inclusions. Among this inclusion, the total intake of calorie and macronutrient distribution did not have variation among endurance and strength. Upon the inclusion of nutrition concepts like diet advice, prolonged exercise program failed to raise the intake of energy in a compensatory fashion. Also, people who began the programs performing daily steps indicated more excellent raise in the protein intake. The motivation towards exercise raised in females only to my surprise. This study was the first investigation of macronutrients distribution among different exercise intervention forms in the circuit. The study's results were regarded in the form finding that had proposed a lack of substantial effects of particular exercise on selection of macronutrients. The literature was scarce, and also there existed minimal trials of the sufficient duration, but analysis was done to investigate whether an increase in physical activity or exercise would change macronutrients composition or daily intake of energy in healthy individuals evaluated via several randomized attempts. But based on the trial, only a few considered various types of exercises were included. Researchers have conducted studies to compare the effect of combined training and endurance on average subject weight. In contrast, other studies showed the impacts of resistance and linear connection of obese people. In this study, however, the outcomes still pointed towards a decrease in energy consumption, although the present study failed to determine the alteration in the contribution percentage of every macronutrient. Reduction in fat composition. The fat intake decrease is evident in study and contributes towards a healthier life. Homogeneous change due to similar diet and advice restrictions. Form of physical activity and exercise linked to diet might help maintain reduced energy intake after ending the program. The correlation between motivation to exercise and diet was evident in all intervention groups apart from the strong team. Generally, correlations seen in influential groups indicated that the individuals who were consuming more food moved to those who consumed less food. Looking at motivation. Regarding exercise and motivation towards diet, the findings demonstrated a proper intervention acceptance by the people. Though motivation level of training did not decrease in men, it definitely did increase significantly in women. Males were encouraged more by competitiveness, and females were encouraged more by beauty-related aspects. Based on previous studies, the results show that more improved quality of motivation for exercise might be promoted effectively on weight management intervention, facilitating sustained weight loss. More results show the autonomous exercise motivation was a powerful predictor for females' continued participation rather than males. Thus, in the present study, weight loss might have facilitated increase dependent on behaviors in females. In conclusions, those starting an exercise program fail to raise energy consumption. People who start a prolonged exercise program fail to raise their energy consumption in a compensatory design if diet advice is induced. The research findings propose that there is a substantial influence of exercise towards the selection of macronutrients or the energy intake. However, they clearly define a general alteration on the parameters upon following the stated exercise program. The relevant rise in protein and carbs intake and reduced total energy and fat intake were reported. Irrespective of the gender, body mass index, category, or exercise types due to the resulting weight loss program. Lastly, there is a rise in exercise and nutritional behavior motivations, though the motivation to exercise increment was evident to women only. And then these are my references for my paper.